Hello guys, now we are live, so we are gonna talk about top 100 MCI MCQs. And if you have any problem in MCI MCQs, you can write to us in the comment box below, or if you want to join our Telegram group, we will mention the link in the description below. So let's start from physiology. Hydrochloric acid is produced by oxyntic cells. Which of the following statement is true about gastric emptying? Decreased by cholecystokinin. Gastric emptying is maximum affected by lipids. Enterogastric reflex is stimulated by all except alkaline content of the small intestine. All are correct about stomach except pylorus has more acid secreting cells. Starch is hydrolyzed in the mouth by ptyalin. Fecal mass is mainly derived from undigested food. Most sensitive taste sensation is bitter. These cells of isolate of Langerhans of pancreas secrete somatostatin. The rate of absorption of sugars by the small intestine is highest for hexoses. Chymotrypsinogen is activated into chymotrypsin by trypsin. Enterogastric reflex is stimulated by all except alkaline content of the small intestine. Transporter of iron into enterocytes is divalent metal transporter. All are functions of CCK except contraction of the sphincter of Oddi. CCK is produced by enteroendocrine cells in the gut. All are principal digestive enzymes produced by the exocrine pancreas except lactase. All are correct about somatostatin hormone except gastroileal reflex. Now let's talk about surgery. Which is the most common site for carcinoma in the esophagus? It is the middle 1/3. A 9-month-old child present with excessive cry, right iliac fossa sausage lumped and blood in his stools. What is the best treatment? IVF antibiotic air enema. Metastatic liver disease is found in what percentage of patients undergoing surgery for primary colorectal cancer? 33%. Which is a common cause of hypergastrinemia? Atrophic gastritis. Dysphagia lusoria is due to aberrant blood vessels. Which is the common site of origin of peritoneal deposits? Ovarian cancer. Which of the following is associated with Gardner syndrome? Desmoid tumor. Hypertrophic pyloric stenosis presents at 3 weeks. A 40-year-old chronic alcoholic presents with distended abdomen, hematemesis, and fresh blood in stool. On examination, huge ascites and distended veins over the abdominal wall are noted. Most likely cause of hematemesis is esophageal varices. A 30-year-old non-alcoholic presents to the emergency with massive upper GIT bleeding. On examination, pulse is 110 minutes and BP 80-60. First step to be taken is large bore cannula for IVF. Which is the rarest position for appendix? Post-ileal. Which is the best way to diagnose lower small intestine obstruction? Multiple air fluid levels. What is the location of the first constriction of the esophagus from the incisor to 15 cm? Which is the best investigation for dysphagia? Barium swallow. What is incorrect about Zenker's diverticulum? Metabolic alkalosis. Achalasia cardia represents presence with all except corkscrew esophagus. Achalasia cardia presents with all except normal peristalsis. Dysphagia mainly follicules is seen with achalasia cardia. A patient presented to you after assault and penetrating knife injury to abdomen. X-ray shows gash under diaphragm. Most common organ damage in this case is intestine. Which is the best investigation for detecting esophageal perforation? CT chest with contrast. Which metaplasia occurs in lower esophagus in a smoker? Goblet cells, intestinal metaplasia. Which of the following is more prone to carcinoma? Barrett esophagus. Glutaraldehyde is used for all of the following except thermometer. Most potent disinfectant is sodium hypochlorite. Sporulation is seen in which phase of bacterial growth phase? Stationary phase. Whole sterilization is done by ionizing radiation. Metachromatic granules can be stained by Albert stain. Most important limitation or drawback of tuberculin test is can't differentiate between latent and active tuberculosis. Transfer of genetic material by direct physical contact in bacteria is called transduction. Lysogenic conversion is integration of each nucleic acid to host bacterial genome. Mesophilic organism grows at 25 to 40 degrees centigrade. Incineration is done by human body parts. Yellow bug is destroyed by incineration. Which of the following investigation must be performed before giving contrast to the patient? KFT. What gold standard investigation of choice for deep vein thrombosis? Venography. The shown image modality is PET CT scan. What is this image called? Orthopantogram. Which of the following is a gold standard investigation for diagnosis of renal stone? Helical CT with non-contrast. Which of the following is a gold standard for investigation of the renal stone? Helical CT with non-contrast. Identify the bone marked with the arrow. It's the humerus. On IVP, this image was obtained. What is its diagnosis? See guys, here we can see the Lilly sign, and this Lilly sign we can see only in the duplex collecting system. MRI spine shows the following finding. What is the diagnosis? TB spine. Most common complication of radiotherapy of head and neck cancer is dryness of the mouth. What is the ossicles lever ratio? 1.3:1. Endolymph is secreted by stria vascularis. Surgical landmark for mastoid antrum is McEwen's triangle. Which muscles arises from the fourth pharyngeal arch? Cricothyroid. Ear lobule is made of skin with fat. All of the following nerves supply auricle of the ear except lesser petrosal nerve. Which is the peripheral receptor of hearing? The organ of Corti. The semicircular canal is responsible for balance. Promontory is seen in which wall of the middle ear? On the medial wall. Eustachian tube opens in nasopharynx. Stria vascularis is present in cochlea. Otoconia is seen in utricle. Newborn is hypermetropic by +2 to +3 diopter. Structure with highest refractive index is lens. Which is true about PHPV? Associated with microphthalmia. Maximum visual field is seen in temporal. Normal intraocular pressure mmHg is 10 to 20. Axial length of the orbit is 2.5 cm. The junction between the retina and the ciliary body is called the ora serrata. All of the following ocular muscles are supplied by cranial nerve number 3 except superior oblique. The cause of acute hemorrhagic conjunctivitis is enterovirus. Klebsiella pneumonia causes keratitis. True about dendritic ulcer is a corneal sensation decrease. Which is the therapeutic indication of keratoplasty? It is keratoconus. Swimming pool conjunctivitis is caused due to chlamydia. To prevent disease transmission from conjunctivitis to patient, which is the most effective way? Clean hand. Stocker line is seen in pterygium. Most common cause bacterial corneal ulcer is Staphylococcus. Salmon patch is seen in interstitial keratitis. Munson sign is seen in keratoconus. Angular conjunctivitis is most commonly caused by Moraxilla. In case of neurotrophic keratitis, which serves trigeminal nerve. Thank you very much and all the best for FMGE exam.